He was 2 sets down. He was getting terrible pain in his foot, and he had not won the tournament for the past 11 years of trying. Despite of all these odds, Rafael Nadal won the Australian Open 2022, and he became the only male tennis player in the history to win 21 Grand Slam titles. But did you know, throughout all this, he was suffering from a rare and painful condition of the foot known as the Muller Weiss Syndrome. Hi, I'm Dr. Swanit Deshpande. I'm a surgeon from Mumbai, and this is a video on Muller Weiss Syndrome by the Indian Medical Tennis Society. So, we are a bunch of doctors who love playing tennis, who love talking about tennis, and we do research on injury prevention in tennis. We bring out such small videos to get information on diseases in tennis, which is authentic, which is evidence based. We are also looking to represent our country, India, as a team at the World Medical Tennis Society annual tournament, which happens every year at a different location. And this year it's supposed to be in the United States at Orlando in the month of October. If this is something that interests you, join us at indianmedicaltennis.com. In this video, subsequently, you'll hear from the experts in the field about Muller Weiss syndrome. And if you need to get in touch with any of these doctors, just look at the link. The contact information is out there.
Hello dear tennis friends and fans. Did you know our tennis favorite and the greatest of all times, Rafael Nadal, suffers from a condition called Muller Weiss Syndrome? Did you know what it is? Come, let's understand a little bit more about it. So this disease is also known as Brailsford's disease. Usually it's something that occurs in females from 40s to 60s. When similar condition occurs in children, it's known as Kohler's disease. Now, if it's something that occurs in females around their 50s, why is Rafael Nadal getting affected by it? Let's try to understand a little bit more. This is a condition that has multiple causes that leads to this extremely painful foot problem. So, let's come to understand a little bit about the foot. Did you know that your foot is made up of 28 different bones? Each foot is made up of 28 different bones, of which there is a very small, in compared to the entire body, but a very important bone which is known as the navicular. Now, Muller Weiss disease is a disease that exactly affects this bone, the navicular. Now, the importance of this bone in your body is that it's known as the keystone of your medial longitudinal arch, which means that beautiful arch of your foot that everybody has and everybody wants is maintained by a very important structure, and that is the navicular. Now, in Muller Weiss syndrome, what happens is this important bone undergoes something known as osteonecrosis. What is osteonecrosis? It simply means bone death. And when a bone dies, it cannot uphold, it does not have its own strength, and then it collapses. This entire process is extremely painful. So our champ, our tennis champ, Rafael Nadal, has been playing for years with this extremely painful condition. So as we go forward with this video, let's try to understand a little more about the different factors of this disease.
So the biggest question is, why an elite athlete like Rafael Nadal should develop a rare disease of Muller Weiss? The theory that has been proposed is of delayed development of navicular bone. That is, ossification or bone formation of naviculum is delayed. So the cartilaginous bone, which is present since birth, is unable to cope up with the extensive forces that a keystone of a dome of the foot has to undergo while doing all the activities like walking, running or playing. Along with the developmental delay, there has to be abnormal distribution pattern of the forces. Uneven distribution of the compression force on the naviculum leads to avascular necrosis. Now let us understand what are the signs and symptoms of Muller Weiss disease. Most of these patients come with long-standing complaint of pain in the middle part of the foot. Some also complain of pain in the heel or in the ankle. Usually, this pain in the foot or ankle is without any predisposing injury or trauma to the foot. Some patients also experience pain along the peroneal tendons. With the progression of the disease, as the navicular bone starts to collapse, patient can develop flat foot known as pes planus. Some patients can also develop deformity in the heel region known as varus of hind foot. With the development of the deformity in the foot, some patients can develop pain in the anterior part of the knee around the kneecap. Now let us understand how the doctors diagnose this condition of Muller Weiss.
Hello friends, I'm Dr. Sachin, Bhonsle, orthopedic surgeon. Muller Weiss syndrome is a painful foot condition which should not be confused with Kohler's disease, which is found in childhood, which can be successfully treated. We have various findings in X-rays, CT scan and MRI scan, and also classification. First, I will show you a picture or an X-ray of a normal foot where the navicular bone can be seen as the shape of a boat. In the CT scan, the finding of Muller Weiss syndrome is we can see fragmentation or cavities in the navicular bone, and in the MRI scan what we see is bone edema, that is the bone looks different color. So the progression of the disease depends upon the stages of the disease. There are 5 stages of Muller Weiss syndrome: stage 1, stage 2, stage 3, stage 4 and stage 5. In stage 1, often there are no X-ray findings, it can only be diagnosed in the MRI scan. In stage 2, we start seeing the lateral collapse, which is the early sign. In stage 3, the bone starts to get fragmented. In stage 4 and 5, flat foot starts to develop as the bone gets very fragmented and the talus starts to articulate with the medial cuneiform. Thank you very much.
Hello friends, I am Dr. Mudit, Khanna, consultant orthopedic surgeon at Wokhart Hospital, Mumbai. Now, as we've understood so far, the culprit bone in Muller Weiss syndrome is a small boat-shaped bone in our midfoot region called the tarsal navicular. Now, in Muller Weiss syndrome, this small bone loses its blood supply for whatever reasons, and as a consequence becomes soft and begins to die. Now, when this diseased osteonecrotic soft bone is subject to uneven loading forces, as happens when we play tennis, it gets crushed between the bones in front, namely the cuneiforms, and the bones behind, namely the talus, in a way that this boat-shaped bone first becomes comma-shaped and then break down into small pieces and undergo what is known as fragmentation. Eventually, as this condition progresses, all the bones around in the midfoot around this navicular bone may become deformed and develop what is known as arthritis or osteoarthritis. Now, coming to the treatment part, if a diagnosis is made in the early stages, which means that the X-rays of the patient look completely normal, but the patient has pain which is not going away, and we get an MRI done which shows signs of osteonecrosis, edema within the bone, etc., then treatment can be done with non-operative conservative measures. And the mainstay of conservative measures is to rest the bone and completely or significantly restrict activity, often with the use of short leg casts or a plaster. The idea is to prevent this soft bone from getting deformed. Plus, what do? We give anti-inflammatory medications. This is to prevent the bone from, to control the pain and swelling. Now, the next part of the non-operative or conservative management is to give supportive or accommodative orthotics, which essentially means footwear modification. And the idea here is to prevent the uneven loading forces from acting upon this soft bone and causing deformity. Now, these conservative treatment options may effectively reduce the pain and improve function, though the pain may not completely go away. But it can often be tolerated for years, and therefore surgery is reserved only for cases that do not respond to conservative and supportive therapy. Now, coming to the surgical options for management of such patients who continue to be significantly symptomatic despite trial of conservative management, well, unfortunately, so far, there's no gold standard surgical treatment that has been agreed upon. Now, for surgical treatment in early stages, which essentially means that a patient has no deformity but still continues to have pain despite conservative measures, the treatment is with a surgical procedure called as core decompression, which may be tried, not effectively proven that it works, but this is minimally invasive. For patients who have advanced arthritis already, which means deformity or fragmentation of the bone has already set in, there is no other surgical procedure that works other than a procedure known as arthrodesis. Arthrodesis essentially means that you fuse the bones in front or the bones behind and convert a joint into a fixed unit. So for advanced stages of navicular bone problems, which means navicular arthritis, you could end up fusing the navicular bone with the bone in front, which is known as navicular cuneiform arthrodesis, or you could fuse the navicular with the bone behind if that is the bone that is affected, which is known as talonavicular arthrodesis, or you may need to fuse the bones both in front and behind, or perinavicular arthrodesis, which essentially means this. Well, that sums it up, the treatment part. Thank you very much.
Hi, I'm Dr. Apoorva Makan, MCH in Pediatric Surgery. I'm here to summarize this condition, which is known as Muller Weiss disease, an extremely rare and a painful condition of the foot involving one of the small tarsal bones known as the navicular bone. The navicular bone is involved in maintaining the medial longitudinal arch of the foot. So bone death of this bone would lead to a flat foot. What are the other features or symptoms seen in this condition? Ranges from subtle discomfort to severe excruciating pain in the later stages. So investigations such as an X-ray or an MRI would show features of osteonecrosis or bone death, and in the last stages would show fragmentation of the navicular bone. So how do we manage this condition? Early diagnosis and effective treatment remains the key to managing this condition. And as guided previously in the video, initially conservative management would be advised for the first 6 months, and failure for improvement in the symptoms would warrant a surgical intervention. Thank you.